I've had patients that have come to me like, I don't have depression, I don't have anxiety, but I've got this really bad pain. It's right here. It's like right in my shoulder blades. No one can figure it out. There's nothing wrong. And I'm like, okay, we start with ketamine therapy. Boom, physical pain gone. And then emotional awareness of something that happened surfaces. Mm-hmm. And now we realize this was an emotional trauma. It got pinned up in the shoulder blades. And I know that sounds like so far out there, but it's like time and time again, the body keeps the score.
What's up, guys? We're back. It's the best Midland Texas podcast. I'm your host, Ryan Shewchuk. This is my lovely co-host /wife co-host, Terra Avery.
Yeah.
How's it going?
Good. How are you?
Today, we have two amazing guests. We have Tammy Vaught, the founder of the Ketamine Clinic of West Texas, and we have Jessica Nosek, who is the patient care coordinator. And you actually started as a patient.
I sure did, yes.
So these two know about ketamine infusion therapy. That's what we're going to talk about today. Also, if you're interested in starting your own ketamine clinic, don't, because you can't. So well, that solves that. Tammy's clinic establishes individualized goals of treatment to provide personalized, high-quality care for patients suffering from significant physical and mental diagnoses. That's not how you say that. Diagnoses. How do you say this?
Diagnoses.
Nice. I'll get it one day, man. First of all, thank you for being here today.
Thanks for having us.
Thanks for having us.
Let's just jump right in. What is ketamine and what is ketamine infusion therapy?
Ketamine is actually an anesthesia medication. It was FDA approved in 1970 to be used in operating rooms. It's an amazing anesthetic because not only does it cause or lead to sedation, it also gives surgical pain relief. So you can kind of hit two birds with one stone with that medicine. It was really popular during the Vietnam War. They would give all the guys a vial of it to carry on their person because that way if someone went down, their buddy went down, they could actually draw it up and give it as a shot into their leg and they would get some sedation and pain relief, but it wouldn't sedate them to the point that it like hampered their breathing or caused them to become hemodynamically unstable. So they would stay stable enough to wait till someone could evacuate them. It's used in operating rooms across the world, super popular medicine. My background is in anesthesia, and so that's my first exposure to it, was giving it in the operating room to help with my patients' pain control and their sedation. It's been being actively studied since the early 2000s for could it be used in outpatient settings to help with other things. Initially, it was looked at for possibly helping with chronic pain, because theoretically, if it's helping with surgical pain in the OR, then why couldn't it be helpful for chronic pain in an outpatient situation? Then it kind of crossed over and noticing its benefits in mental health. Initially studied specifically for treatment-resistant depression, and then it's just really evolved, especially in the last probably 5 years, as far as really noticing how it could benefit mental health treatment, kind of across the spectrum, a variety of mental health diagnoses. But it's a really, really special and unique medication. It works in the brain in a really unique way. As far as from the mental health side of things, it's not just kind of a one-trick pony, if you will, only working in one way. That's why I think we get such a robust response with it, because we're targeting certain receptors, we're targeting neurogenesis, so regrowing of the neurons in the brain. It's targeting inflammation, bringing down inflammation in the brain and the body. So because it's working from a whole lot of different avenues, we get really great response. To answer the second part of your question, as far as ketamine infusion therapy, it's utilized in my clinic and clinics across the country as an IV administration of the drug ketamine. So meaning we're giving it intravenously. We're starting an IV. We're drawing up a very specific amount of medicine based on weight, based on diagnosis. It's then programmed into a syringe pump to run over a specific amount of time. And then it's not only just the single infusion, it's a package of infusions. It's a series, and that's designed because each infusion kind of builds off of itself, augments, continues to solidify results. And so it's not a one and done infusion. It is multiple infusions designed as a series to best help the patient. That's the best well-studied form. Ketamine can also be delivered nasally, orally, what we call intramuscularly or IM as a shot instead of an infusion. In my clinic, we utilize IV only, and that is because, well, I think it's superior. It is superior.
There you go.
It's the most well-studied. It's the best studied. And because it's 100% bioavailable, if I give you 50 milligrams, Ryan, in your vein, you're getting 50 milligrams versus if I give you it as a shot or we do it orally or nasally, you're only getting a fraction of the dose. And so 100% bioavailability in the vein. And so it's really, really controllable, titratable. It's very predictable. I know what I'm giving you, and I know how to adjust and make adjustments if we need to. My initial background is ER. Like I worked at a trauma center for a long time in Detroit. I've seen all the things. And then I decided to go into anesthesia. Oh yeah, all the things.
Detroit.
Yeah.
Okay.
8 Mile. And so then I went back to school about 3 years. 2020, I went back to school and became a psychiatric nurse practitioner as well. So a PMNMP, psychiatric mental health nurse practitioner. And I decided to do that because in the ketamine clinic world, there's a lot of push and pull on who's the appropriate provider to administer this. Is it anesthesia because it's anesthesia medication and we're the most qualified to monitor someone, treat complications. Like that's what I do all day is keep someone alive on an operating room table while a surgeon tries to kill him. That's my gig. So the psychiatric world would say it's theirs to administer because we're treating mental health. So they're going to be the most qualified to understand the disease processes, understand the medications people are on, to combat any kind of derail in the mental health portion of things and work in the crisis of things and the trauma. A lot of clinics are going to like a hybrid staffing model where you've got anesthesia and psychiatry together running a clinic. And so rather than hire someone else to be with me, I just decided to be both.
Nice.
Combo.
Works out pretty great, actually.
Yeah, it
Cut
makes
out the
sense.
middleman.
Yeah, I feel like my patients feel really well supported in that because they know I've got the safety knowledge component of the anesthesia. Like if something's going to go wrong, I'm going to be able to manage it.
Yeah.
And then they now feel really well supported that I can be alongside them in the trauma, in the psychiatry side of things with their medications. If they're wanting to try to wean off or augment or change, I can manage that with confidence because now I have the knowledge.
So how long have you been in West Texas and Midland, and when did you start the ketamine clinic here?
So I opened Ketamine Clinic of West Texas in October of 2017.
Okay.
Wow.
So over 5 years now. And I'm still one of the only ketamine clinics in West Texas. I think there's now one in Lubbock, but there's not one in Abilene, San Angelo. Of course, not in the Alpine. Thinking of where we get patients from, the Alpine Marfa area.
Yeah.
El Paso used to have one. I don't think they have one anymore. So we've treated El Paso and New Mexico as well. So I definitely kind of brought. I was the first CRNA or CRNA-owned clinic in Texas. I was one of 5 clinics in the state, and now there's probably 100 clinics in Texas now.
Oh, really? Okay.
I'd like to expand on that, though. There are places that do administer ketamine for mental health in the area and in West Texas in general, but not the way we do. We're a compassionate care clinic, so we we're there from start to finish. We basically hold their hands and walk them through, and we're there to support them through their entire experience, through all 8 infusions if we do 8, through all 6 if we do 6, that kind of a thing. I mean, they are fully supported. Whereas in a lot of the other clinics or other areas that they do administer ketamine therapy, it's really done in though ours is a clinical setting. Theirs is more like a doctor's office, where ours is like a spa, kind of. It is.
Okay.
I mean, it is a clinic, but again, they just kind of bring them in, shoot them up, and ship them out. I don't mean to simplify it like that, but they don't have that. They don't have that support that our clinic gives. I mean, we truly develop relationships with our patients.
Okay, so you don't feel like you're just in your standard stark white doctor's office.
In the psychedelic wave that is current and moving forward, there's a lot of buzz around the 2 terms of set and setting. You'll hear that terminology if you're talking with anyone that has any experience in any psychedelic format at all, that your set and setting are key to your experience, because this is an experiential treatment. So your setting being the environment in which you infuse, and then the mindset or set that you bring to the infusion. So the setting, having a place that feels really safe, really, really secure, quiet, peaceful, where people can really come in with confidence, knowing they can be vulnerable and let down their guard and know they're going to be cared for and loved on, and that they are really well taken care of, is hugely important. We're working in trauma. It's vulnerable. It's a really vulnerable space, right? But then also the mindset that someone brings. So any office that's just like bringing someone into, with those like half beds where you sit up on it and you've taken your blood pressure, and then they say lay back, and they pull out the end of it, and you're laying there, and they just drop a ketamine shot in your arm, and it's bright and it's sterile and doesn't feel warm and comforting. This experience is probably not going to be ideal or therapeutic.
Why did you decide to open up the clinic here in West Texas?
So I have cared about the mental health world for as long as I can remember, as someone that as early as I can remember in my teens, 16, dealing on and off with depression here and there, dealing with my own various traumas in my life that I've had to intermittently work through. I've always been passionate about mental health, but I had a very good friend who was suffering from treatment-resistant depression and chronic pain. He'd been through all the medicines, all the treatments. Nothing's working for either pain or his mental health. So I started researching for him, looking for other options, things out of the box. And ketamine came up in my research. And I was pretty enamored because I give ketamine in the operating room. At the time, I was doing anesthesia full-time. And I was like, what the heck? I had no idea this being used in an outpatient clinic. So I started reading everything I could find. Could this be helpful for him? And I went and looked for a clinic, and the closest thing was in Dallas. Well, because it's a series of infusions, it would require travel. It would require multiple stays in a hotel. It would have been very expensive on top of the ketamine treatment itself. So I just started thinking about it, and I'm like, is this something I could do? Is this something I could offer? Like, what are the possibilities? So I started researching how I could make it happen, and I had a unique opportunity that I was doing private anesthesia for a surgeon in his office, and he had space in that office that I could kind of like expand into. And so I decided to open this clinic really with the intentions of treating Steve, and with the hopes that I could change his life. And then if I had to shut it down after that, like if I decided it was a once and done, then I helped him, and that was it.
Yeah.
And then unfortunately, 5 months, I guess, around 5 months after I opened my clinic, he ended up dying by suicide before I ever was able to treat him. And I had probably treated about 10 patients by that time, maybe 15 before him. He was real hesitant. He's like, I don't know, Tammy, that just sounds too out there. He was an older guy. And so when he ended up dying by suicide, it was kind of like that was a catalyst or a fuel for me that I needed to grow this and try to find a way to get this out to more people and stay passionate about the clinic. And from there, it's just evolved. I'm constantly, you can ask Jessica, looking at ways, how can we better support our patients? What can we add in as another layer to make sure they feel supported? How can we get this out to more people? Should we change this protocol? Should I offer it to these people or this population at a different price because they're a unique group? Or, just constantly evolving. And then here we are now 5.5 years later and several hundred patients later and more passionate about it than ever before.
I mean, when you're opening up and you're the first one in Texas, right? Like, how are you marketing?
Texas.
Yeah, how are you marketing to the public?
Yeah, I mean, if I'm being honest, early on, I stayed very under the radar because I knew, especially being in West Texas, it was going to have some stigma around it. And I still today get asked, is this even, patients come in and they're like questioning, about what if my boss or something, with work, and I'm like, you're under medical care with a medical professional. Like, you're not doing anything illegal. This is recreational. This is not recreational. This is a legitimate medical clinic with a medical provider with degrees of training, and we're utilizing this amazing medicine to hopefully impact a life. But honestly, when I first opened, I tried to be very under the radar because I didn't know how it was going to be received.
Right.
And early on, other physicians and different people were like, no way. Like, I'm not sending my patients there. I don't know anything about this, because I was so kind of ahead of the curve on it. But then now, because it's in the press, like, there's news reports on it almost, I swear, it feels like almost weekly these days. There's something out. More and more providers are more willing to be like, let me refer you over to this ketamine clinic that's new. We talk a lot. Jessica's gone, and I've gone before. I brought Jessica on to talk with therapists, like therapy groups, counselors are a really great way to get the word out.
Word of mouth, really, as well. I mean, the success rate is it's so great that people tell their friends about it. And it's such a conservative community that it is a little hush-hush still because, it's psychedelics and, this is a very conservative community and it has this reputation of being, a veterinary drug or a party drug and, animals take the same antibiotics, as people do, and this is the same kind of medication. It's very versatile, used in various different ways. I even went to the extent of doing some research as to, where psychedelics fit in with Christianity because we want people to feel comfortable with the therapy that they're about to embark on. We don't want to compromise anyone's faith or make anyone feel uncomfortable or anything, but it's a conservative community, and so people are kind of whisper to their friends like, oh, hey, I did this thing, and I tell you what, it actually really changed my life, and I know you've been suffering, maybe give it a shot. So really a lot of word of mouth has been the best advertising for us.
You spoke a little bit about like some of the misconceptions, right? People coming in thinking they're doing something illegal. Like what are some of the other common misconceptions?
One of the biggest stigmas that we fight against is that, like, oh, this is just for horses or pigs. It's a pig tranquilizer. Yeah. Oh, gracious. No, it's saving people's lives.
Well, and I think another misconception that I've heard over the years is people worry about if this is a drug of addiction. And then, where you're just trading one drug for another. And interestingly enough, a lot of my patients have come in on multiple medications. Maybe they're taking an antidepressant and something for sleep and something for anxiety, and they're taking a mood stabilizer. And they're taking multiple antidepressants. In exact the opposite, they've been able to do ketamine therapy, and maybe they do some maintenance infusions periodically, but now they've come off of multiple of their list of medications they're on or come down on. Often, benzodiazepines being like Klonopin and Xanax, Ativan, highly addictive medications that were never supposed to be a medicine that people were on long term, supposed to be in crisis, but now it's become something that people are very dependent on. I've had many patients come in, truly, I mean, their body is addicted to this medication, and we've been able to do ketamine therapy, and they've been able to drop their benzodiazepine completely. And it's, so I really try to help people to understand that while, yes, it is a bridge, and it is a medicine for a medicine, when the long term is that you're coming off of medicines, ketamine is not something to be on long term. It's not something you're going to go home with. It's not something that you're going to be taking daily from the house. And so that was a misconception early on that I've had to do a lot of dispelling.
Well, and then with like antidepressants and benzos and all that, like when you do either try to wean yourself off, or a lot of people start taking them completely like cold turkey, and that can be dangerous. And like, I feel like with the ketamine therapy, you're not having to worry about like brain zaps and craziness.
That's exactly right. Yeah. It took me about a year after my initial series to come off of my antidepressants. And I tried to be a hero the first time. I tried to get off my antidepressants and just quit cold turkey. And that was so dumb. That was so dumb. But
It didn't feel great.
I mean, it was physically difficult. But emotionally, I was fine. I felt totally fine emotionally because I felt supported with my ketamine experience. But now I'm completely off of my antidepressants and benzos and all of the things because I feel emotionally stable. All of my receptors are all repaired and all of the things are lighting up in the right ways. And so I'm not taking any of those medications.
What does treatment look like in terms of who are the best candidates in your opinion?
Best patient population is typically, someone that has been on their mental health journey for a little bit. They've probably tried a couple of medication options. Maybe they've been in counseling for a little while. And I would say probably our most successful patients are those that have really done some great work in therapy, and they know they have some tools already, and they just feel like they've kind of like hit a stuck spot, and they're looking for that next thing to kind of push them through. Most people, I would say, I don't know if I can put a percentage on it, but really high percentage of patients are a candidate. People that come to us and ask us about the potential for ketamine therapy. There are very few like hard stop contraindications. It's a very safe medicine, so there's not very many contraindications. But one, Jessica does almost all of our pre-screening, and she knows that if someone comes and calls and says, I think that I'm experiencing depression, I think I'm experiencing some anxiety, I've never been diagnosed, I've never gone to a mental health provider, and I wanted to think about ketamine therapy, that unfortunately at this point in time anyway, it is not a first-line treatment.
Okay.
I wish and hope that one day it can be, because I feel like the potential for putting someone in remission that's early and newly experiencing a mental health crisis, that it could put them in remission and prevent them from ever having to go on an antidepressant. But at this point right now, that would be irresponsible of me as a medical provider to offer it out that way. So most of our patients have been on their mental health journey for a while. They're feeling stuck. They're feeling like they've tried medicines that either have undesirable side effects or just haven't gotten them where they're hoping for. And they're looking for something out of the box that could change their path.
If I come in for ketamine, what can I expect? How can I expect to feel? What are some of the benefits I'm hoping to feel, and what are some of the potential side effects with it?
Well, Jessica, since you were a patient, why don't you answer that one?
Well, let's start with the side effects because that's a much shorter story. So because it's also it's also used in anesthesia, we're not going to let you have a lot to drink, like no fluids, a couple hours before. So after your infusion, you may have a little bit of a headache due to dehydration, and basically that's about it. Really, then after your infusion, you're free to eat and drink whatever you want. You'll want to go home and take a nap, and then you feel fine. It's almost like you've been kind of day drinking a little bit, really. I mean, everybody feels a little different, but generally speaking, that it feels like you've been at brunch.
Is the intent of I'm just laying there and just listening to music? Am I talking with somebody? Like, you know what I mean? How does that work?
So we have 3 infusion rooms, and each room has recliners in it. So you'll be in a recliner. You'll have a sleeping mask on. You'll be wearing headphones, earbuds, whatever you choose, and you'll be listening to a playlist of your choice. We always recommend like ambient music, nothing too jarring, nothing too crazy. I'm a huge Metallica fan, but definitely not Metallica. But just something very chill,
Soothing.
very soothing, right? And so then you're just in that chair for about an hour.
Okay.
You're in the dissociative zone, that psychedelic trip zone, for about 40 to 50 minutes. And I'm not sure if you guys have had any experiences with psychedelics, recreational or otherwise. I won't judge. I've done them all.
I haven't done anything. So I that's for me, like, I don't know what to expect at all.
Okay, so the visual, the psychedelic trip part of it is unlike like your, I guess, traditional psychedelics like psilocybin or LSD. Those are highly visual medications. If you're looking around the room, the walls might breathe, the patterns in the carpets might move, the paintings on the walls might be wiggly. Things are kind of bright and sparkly. With ketamine, you're in your own world. Again, you're wearing a sleeping mask. Any visuals that you'll experience is just going to be in your mind's eye.
Okay.
And at that point, it's really kind of up to the individual of what that experience is going to be. A lot of people will experience a lot of like textures, a lot of maybe just sort of like moving, sort of Morpheus colors. You might find yourself in different environments. I typically find myself at the bottom of the ocean. In a very metaphorical way. Nothing is really literal in a ketamine experience.
You're not with James Cameron in the abyss?
No, no. But we'll get into what that means. When you find yourself in different environments, and what that means. Because like at the beginning of my series, I found myself at the bottom of the ocean, and it was very overwhelming, very claustrophobic, scary. Those kinds of things. And then further on in my infusions, I'd still find myself at the bottom of the ocean, but the water was a different color, and it wasn't scary. It was very peaceful. I was very curious. I wanted to, kind of look around and explore. So it was very, very much paralleled what was actually happening in my life, and it kind of, went with what, my emotional and mental healing as well. So though I found myself in the same sort of environment, I felt very differently about it. Sometimes I'll feel as big as the universe and as small as an atom at the same time. Very
And like you said, and then once your hour's up, basically for the rest of the day, you're totally fine. Like, you're not feeling that way?
Well,
other than being thirsty?
Right. I mean, you'll feel a little sleepy. And, we can't let you drive because, you've been on medication. So go home, take a nap, and chill for the rest of the day.
You can't drive or return to work or anything because you have to consider this still as though you've received like an anesthetic, even though you're not put to sleep. So you're in a state of consciousness such that you can ask for your needs. Like if you started feeling nauseous or you were cold or you wanted, you didn't start out with a sleep mask on and you decided I want one, you're going to be able to verbalize all that.
Okay.
You're not in such a level of sleep like an anesthetic where you all of a sudden wake up in the recovery room and you're like, the heck happened? When are we going to start the surgery? And we're like, we already did it. You definitely can open your eyes and have an awareness. I encourage people, the more in it you can be, the more you can surrender to the medicine and just be able to observe, be an observer in your mind, the better. And usually that takes some time. The first infusion, most patients can't rest into it like that. They're coming in cautious. They're coming in anxious.
They are what to expect.
They don't know what to expect. They don't trust me yet. They don't trust my nurse Amy yet. And then as they go through the series, you start to notice them being able to relax into it. And then the more they're able to relax into it, the more they're able to garner from the experience. And you asked if someone is like in there with you. Are you talking? There are times where a patient has a whole lot to say after an infusion, or even mid-infusion. They'll ask Amy, my nurse, can you get Tammy? And I come in and I'll pull up a chair and hold their hand, and if they've got something to talk through, we'll talk.
Yeah.
And then sometimes after an infusion, I come in afterwards, and they're like, that was interesting. I'm like, anything you want to share? And they may divulge something specific or really psychologically profound that they discovered about themselves or about their past or about what they hope for their future. And then sometimes they're like, I don't even know what to make of that. And I'm like, that's okay. Cool. Make a few notes, jot down some colors, shapes, feelings, emotions that came up, but don't try to overanalyze it, because even if it wasn't psychologically profound for you, it was still chemically profound in your brain doing its job. So don't overanalyze the fact that you don't understand what that shape and that color and that particular wave of woo-woo meant to you.
Can you expand on what it is doing to your brain and what you're looking to gain from it, I guess, you know, because I hear this again. I don't even like taking any medication. I hate it, right? Because I sit there and go like, I don't know what it's really doing. I'm the worst candidate to know how, if a medication is doing its job per se over time. She's a good indicator. She'll let me know if it's working, but I don't know.
Yeah. So the best way that I can describe, so when you're on a typical antidepressant for depression, in whether, I don't know if you guys know this or not, but your typical antidepressants that are like your traditional SSRIs like Prozac, Zoloft, those kinds of medicines, they're binding to serotonin receptors. Okay, so think of it like a receptor like this, and it's got a little hole in it. And so the medicine goes and it binds to that. And what that allows is for the serotonin that's free floating in your body to stay more active and free floating so that it doesn't come into the receptor. It's like capping off the receptor so the serotonin can stay in your body, which then gives you a mood lift, right? But that cap on the receptor, it only lasts for so long, and then it slides off. So that's why you got to take it every day. So put the cap back on, put the cap back on.
Okay.
So it's temporary, and it's really symptom control, okay? Hugely beneficial. Like, I'm not saying that we don't need antidepressants in our world, but they are symptom control. They are not anything that is going to do anything to improve the quality of your neurons in your brain.
Yeah.
Okay.
Ketamine, on the other hand, one of its biggest claim to fame and its awesomeness is that it helps to mass produce a protein in the brain. It's a protein that's already naturally occurring in our brains. It's called brain-derived neurotrophic factor, BDNF. It's already in there. It's the protein that specifically goes to all the billions of neurons in your brain and makes them work to their best function. And we all need BDNF to be really, really working well in our brain. Well, as we go through life, as we experience traumas, as we experience lives of medication taking, drug use, physical trauma, like a football player that's been hit in the head a bunch of times, or emotional trauma, spiritual trauma, whatever, that BDNF production goes down.
Okay.
All those roadways in the brain, all those neuron pathways start to get mucked up. They start to get like what we refer to in our clinic like potholes in them. They're just not, the current's supposed to be going from A to B, and it's fallen off into a pothole. The current just can't flow. Ketamine increases that production of BDNF so that BDNF can go and repair all those neuron connections, fill potholes, so that all the neurons can communicate better again. So it's actually neuroreparative at the cellular level. And there is not another medication right now that is doing as good of a job at that as ketamine. There's some new things on the forefront that are coming out largely because of what we know about ketamine.
Yeah.
But that it actually is repairing the neurons. It's causing neurogenesis, regrowth of the neurons in the brain, which is remarkable because I think at one point in time in life, in science, we thought we were born with billion neurons, and once they started to die off with aging or whatever, like there was no chance of getting any new ones.
Yeah.
You were just,
SOL.
SOL. Now we know we can grow new neurons. We can optimize our neurons, and ketamine is one of the medicines that can do it.
I have a question. So is there
Did you raise your hand? There you go.
like research out there about like maybe using ketamine therapy for like Alzheimer and dementia patients and how it can help them?
Good question. There is some very, very limited starting research on that. It's because of all the things we're seeing with the possibilities with ketamine. Every research center in the country is trialing all kinds of things, like ALS. There's a research center in Florida that's utilizing ketamine for early ALS patients. That's Lou Gehrig's disease. Alzheimer's, there is the thought that it could possibly help to prevent progression of. And so I would say, hey, if someone knew that they had the markers, you can draw genetic markers now if you have a family member that has Alzheimer's to see if you could potentially have that genetic marker to predispose you to Alzheimer's, that maybe considering ketamine therapy in some kind of a maintenance several times a year kind of a thing, could it possibly prevent you from developing Alzheimer's?
I'll sign up for that trial. I don't know if I have the markers, but
maybe. We don't know.
wow.
It's going to be a really exciting time going forward to see how these medicines or any new medicines that'll be on the horizon that are going to be patterned after what ketamine does in the brain.
What's the typical, I think you said earlier, like 6 or 12 or something. What's a typical type of number of treatments or length of time that?
Our mental health series is 8 infusions.
Okay. Over what period of time?
Over the course of about 9 weeks. Over the first 3 weeks, we really load you up. We do 2 infusions per week. And then we skip a week, do an infusion, skip 2 weeks, and then we do another infusion. And I like to think about it like if you bake a super cheesy casserole and it's time to do the dishes, you dump a whole bunch of Dawn in that thing and let it soak for a while.
Yeah, I let it soak for probably
Like 3 days.
Yeah. Then she goes, hey, it's been soaking long enough, dude. Do the dishes.
We really front load that medicine in because, like she said before, it all builds upon each other, right? So, we really put that medicine in and then let it do its thing and
bathe those nerves. Bathe those nerves.
Bathe those nerves. Not in Dawn soap, but in ketamine. Right.
Is there? You talked a bit about like good candidates. Is there who is not a good candidate for ketamine infusion therapy? That's a tongue twister.
There's literally kind of a couple main categories. First category is if you have significant heart disease. Okay. And I don't mean that if you've ever had a heart attack that you could never be a candidate, but if you are newly off of having like a stent placed or you've just recently had cardiac bypass or you have coronary artery disease that isn't currently managed, not a candidate. Ketamine can increase blood pressure. It's considered a vasoconstrictor, meaning it makes the vessels kind of clamp down. So that would put stress on the heart if you have a heart that's already stressed. So not a candidate until you get your heart fixed. And you're about a year out from any kind of major heart intervention. Same with stroke. If you have newly had a stroke, you're going to need to be a year out from a stroke.
Okay.
Second form of candidate, pregnant or breastfeeding, not a candidate. Breastfeeding's a little bit of a iffy because depending how we're spacing out infusions and things, it's not completely a hard stop, but my preference would be that someone is not breastfeeding and definitely not if you're pregnant. And then number 3, if you are actively experiencing psychosis, so just because you've had a history of psychosis, maybe you're a bipolar, have a diagnosis of bipolar disorder, and there's been a period of time when you were unmedicated that you were having psychosis and experiencing hallucinations or extreme paranoia or grandiosity and maybe had to become inpatient for a little while to get managed. That does not preclude you from being able to pursue ketamine. But if you're actively having psychosis, you need to become medically stabilized before you can pursue. And really that's kind of the main 3.
Active addiction. If you're drinking without ketamine is processed in the liver. If so, and not to say that you can't have a couple of cocktails here and there in your life, but if you're experiencing and if you're an active addiction with alcohol, super stimulants like cocaine or meth or something like that, not a great time. But if you're in recovery and working your way towards sobriety. you
can really be helpful in sobriety.
absolutely
Can really be helpful in maintaining sobriety.
right.
Interesting.
But if you've got to have, a handle of whiskey just to get out of bed, probably not a good day to come in for an infusion. So.
And I've had some patients that presented to us that were active in their addiction and then went to rehab, and coming to our clinic post rehab was part of their recovery plan. Like that was kind of pre-established with their treatment center, that they were going to start treatment with us when they came out of their 30-day program. And it's been really, really successful for them in that situation.
Because of how the medication works chemically, right? Like as she was saying, those the potholes and the caps and all that stuff. When things are firing properly, then and ketamine helps to repair everything. Then it helps really curb those compulsions to use again.
This is fascinating. I'm thinking of all the different people that I'm like, oh, maybe this would benefit them.
I did want to ask. I didn't want to pry, but I am curious on how you decided to, one, how ketamine infusion therapy got on your radar, and why you decided to take it, and then how did you make the leap from being a patient to now working with Tammy?
I experienced a betrayal trauma about 3 years ago, and it was very significant. I found out my husband had been having a long-term affair, and this is going to be a long story, so buckle up. So let me preface this with a little story about ego and our sense of self. Our egos and our sense of self, our self-perception is it starts from the minute we open our eyes as babies, right? There are things that we innately know about ourselves, right? Like, I'm a creative person, right? I know that about myself. Nobody had to tell me that. Nobody has to validate it, and nobody's ever going to take it away, right? Everything else, though, we learn from outside sources, from our parents, our siblings, our friends, teachers, coworkers, all of that. Good, bad, or indifferent, that becomes part of our sense of self, our perception of self, right? So, as we get older, we start to think, okay, am I smart enough for my teachers? Am I cool enough for my friends? Am I attractive enough for my lovers, right? And we surround ourselves with people who keep validating those things. And essentially, we can find ourselves, I did anyway, I put all my eggs in one basket, where I really, truly, I forgot my own value, because my value was really all into this man, this my husband, right? Am I capable of providing for myself and my family? Am I strong enough to do that on my own? Do I have this? Well, I forgot to remind myself that I had that value, and that I had that sense of self-efficacy. So when that was taken away from me, I was very lost. I felt like I had no value. I couldn't rely on myself. I couldn't trust myself. I didn't feel capable of doing anything. Not just supporting myself and my child, but I didn't feel capable of getting out of bed and brushing my teeth and going to check the mail, all of these things were so overwhelming. I was not capable at that point of functioning as a human being. And so I was in a real bad way, right? And again, I told you I've known Tammy a long time, and she encouraged me to try ketamine therapy. And I'm a very skeptical person. I'm a very cheap person. I'm super thrifty. I don't want to spend any money.
Same, girl.
Right. And I was so heartbroken from this betrayal trauma that I really didn't know what my problem was, other than I just didn't know how to get out of bed, really. So I didn't know exactly what problem I needed to address. So she talked me into ketamine therapy. And so through my infusions, I gained a different perspective, a different sense of self, right? I like to explain ego like a, excuse me, I like to explain ego like a wet dog. You've got a dog, you've got the fur that is a part of the dog, you've got the water that is on the dog, but not part of it, right? So in psychedelics like ketamine, it'll take that ego out of you, and like a dog will shake it all off, shake off all the water, leaving only what is left, what is just the dog and the fur that's part of the dog, just that. Everything else wasn't valuable. Everything else wasn't necessarily true. It wasn't useful. So I got that sense of self back. I got that, I learned that I had that self-efficacy. I learned that I could rely on myself. I learned that I can, and I do, just on my own. And I didn't have to have I had all my eggs in the wrong basket. I didn't have a single egg in my own basket, and now I do. And so that's how ketamine helped me. I want to talk about bad trips for a second. We don't use bad trips.
I was going to ask, but I didn't. I felt like I don't know if it was a relevant thing, but
No, it's incredibly relevant because it's everyone's biggest fear. Everyone that walks in the door, their biggest fear.
It was such a biggest fear I didn't want to ask because I'm sitting there going, and because I've only heard about it.
So bad trips, we don't call them bad trips in our clinic, and really in this industry, we don't like to call them bad trips. We call them challenging journeys or challenging experiences. And if you think about it, and I know that I'm not well today, so this is a perfectly relevant analogy, is that if you've got a stomach bug, you've got something terrible in your body, and it's going to come out one of two ways, right? Neither one of them are pleasant, but they're productive, right? Mm-hmm. So that's what we equate to with like a challenging journey. Because I mean, you're there for your mental health. Mm-hmm. You're not there, you're not there just for funsies. This is Texas, and as the laws are these days right now, it's not. We can't just do this for fun, Sure. This is a clinical setting, and you're there for a purpose, and if
with a legitimate diagnosis,
with a legitimate diagnosis, that's exactly right. And so you're going to get into your head, and there's some dark places in there, and you're going to face those things, and that's okay. That's good. That's a positive thing. As scary as it is, you're only in there for like 40 to 50 minutes, and you can do anything for 40 to 50 minutes. Mm-hmm. And
often those challenging experiences are the most healing and fruitful. Mm-hmm. Like in the moment, patients are like, I didn't love that. But then when I spend some time with them, well, tell me what you didn't love about it. And then we talk through, and then, they come back for their next infusion, and they're like, as much as I did not love that experience, like I feel such a sense of weight came off of me with that kind of purging, emotional purging. A recent conversation I had with a patient, she was kind of like journeying in her infusion, trying to find her inner child. Like she was looking for her little girl, and when she finally found her, she was about 4, and she was so happy. She was so bright and happy. And her initial response when she was talking to me about this was like, that one was really, really hard. That one was really hard, and she was very tearful, of course. But then when we were talking about it, and then she just started crying, just weeping, and the smile came across her face, and she's like, I'm so glad she was in there. I'm so glad I found her. And like it was really, really sad and dark trying to find her. It was dark for her. But then when she found her, and she's like, just to know I was able to find her, and she was so happy. And she's like, I'm so glad that I found her. And it became this really, really beautiful experience for her. But in the moment, she was like, this is dark, and I don't love it. Mm-hmm. But what she brought from it and was able to take away, and how much healing she gathered from it was like,
that's where the magic happens.
Mm-hmm. I have a friend doing ketamine infusion therapy for chronic pain. Mm-hmm. Yeah. And she loves it. It's like super helpful for her.
We have a lot of patients that come to us with some severe neuropathy that, and fibromyalgia. And, that's another thing, is that like with something like fibromyalgia, like, mind and body is very much interconnected, right? So when your mind feels terrible, your body feels terrible, and then it just keeps keeping on.
Yeah.
And so, but chemically speaking, like she said, it has such powerful anti-inflammatory properties that, things actually do feel better in your body, and then, of course, in your brain as well.
Well, fibromyalgia, that's a whole unique topic in and of itself, because often fibro is really a pain diagnosis that's given when the doctors can't find out. There's no physical reason that the person's experiencing pain. Like, they can't find a muscle or a joint or a bone or anything that should be causing this pain, but yet they're hurting. So they just give it this overarching fibromyalgia. And often it's interesting because I'll ask patients that have a diagnosis of fibromyalgia, and I'll say, when did you get diagnosed with that? Oh, about 4 years ago. And I'll say, what happened? What traumatic event happened 4 years ago? And they're like, oh, nothing. And I'm like, oh, okay. And then as we're talking, they'll be like, so 4 years ago when my parents died in this car accident.
Yeah.
And I'm like, And literally often fibromyalgia is emotional pain that's being stored in the body. And I've had patients that have come to me like, I don't have depression, I don't have anxiety, but I've got this really bad pain. It's right here. It's like right in my shoulder blades. No one can figure it out. There's nothing wrong. And I'm like, okay. We start with ketamine therapy. Boom, physical pain gone. And then emotional awareness of something that happened surfaces. And now we realize this was an emotional trauma that got pinned up in their shoulder blades. And I know that sounds like so far out there, but it's like time and time again, the body keeps the score.
Well, listen, we really appreciate you both coming in today and really educating us on ketamine infusion therapy. I probably have 1,000 more questions, but how long can this podcast really go? We'll have you guys in.
It's gonna be
we'll come in for a
DMing
part
y'all
2.
all night.
Yeah, for sure. We'll just let's all just create a whole new podcast about it.
Let's do it.
There we go.
I'm in.
Always wrap them up with the takeaway. So again, if you are interested to learn more about ketamine infusion therapy, go to ketamineclinicofwesttexas.com. What a great domain name. Again, reach out to Tammy, reach out to Jessica, and let's see if they can help you. Thanks again for coming in.
Thanks for having us.
Thank you.
And we will see you next time. Bye. Boom.